Hi, my name is Angelo Tenorio, and today I will be talking about the importance of infection prevention for healthcare workers. It is important for healthcare workers to prioritize the safety and health of both them and their clients. One significant way in which these healthcare workers can accomplish this task is by emphasizing materials and procedures that would prevent infections. It is important to highlight these things because healthcare workers have to either prevent or reduce the amount of foreign pathogens entering into a client's body. This is important because if any amount of microorganisms reach inside the client's body, it may worsen their condition and it may lead to their demise. We emphasize the need to not just to be clean, but to be also sterile because we are trying to stop the spread of foreign materials to a client's body. However, in real life, we cannot stop all sources of foreign objects from entering the client's body. So, for healthcare workers, infection control is one of the actions in which we aim to prevent or stop the spread of microorganisms in a healthcare setting. There are specific procedures placed by every hospital in which every healthcare worker must abide by in order to reduce the number of microorganisms from spreading from one person to another. One of the easiest ways to prevent infections is by learning and practicing proper hand washing techniques. Hand washing is the first thing a healthcare worker must do so that their hands can be clean. Our hands frequently touch everyday objects, and these objects can carry bacteria with them. We also frequently touch our eyes, nose, and mouth unconsciously without us noticing that we are doing it. As a result, germs have an entryway in which they can enter our body and make us sick. We may also be handling food with these unclean hands, and that is another way in which germs can enter our body. The point of hand washing is to reduce the amount of foreign particles on your hands and to reduce the amount of cross-contamination of these germs from you to another person via directly or indirectly. Washing hands prevents illnesses and spread of infections to others. Also, indirectly, hand washing can reduce the amount of people using antibacterial products, which makes it less likely bacteria can mutate and become resistant to our antibacterial products. If a bacteria mutates and becomes resistant to our antibacterial products, it will become difficult to treat these supergerms in the future. Having a sterile working area is also an important variable to prevent the spread of infectious pathogens. Having a sterile field is also important so that you can place your sterile equipment on it without the fear of these medical instruments getting infected by foreign particles. Maintaining a sterile field is an important component of infection prevention. These sets of practices that are performed before, during, and after invasive procedures to reduce the number of potentially infectious microbes and help to reduce the risk of pre to post procedure infections. By maintaining a sterile field, it minimizes wound contamination and reduces the patient's risk for surgical site infections. Things such as aseptic techniques are strictly applied and used in all clinical settings in which healthcare workers have to operate in or around a client's body. While these practices differ from one hospital to the other, it is important to note that the end goal is still the same, to make sure that their area is as free of foreign pathogens as much as possible so that there would not be a contamination to the client. Sterilization of medical instruments is also a key in preventing foreign pathogens from infecting the patient. Sterilization destroys all microorganisms on the surface of an article or in a fluid to prevent disease transmission associated with the use of that item. While the use of inadequate sterilization represents a high risk of transmitting pathogens, documented transmission of pathogens associated with an inadequately sterilized items are exceedingly rare. This is likely due to the wide margin of safety associated with the sterilization process used in healthcare facilities. Medical devices that have contact with sterile body tissues or fluids are considered critical items. These items should be sterile when used because any microbial contamination could result in disease transmission. If these items are heat resistant, the recommended sterilization process is steam sterilization because it has the largest margin of safety due to its reliability, consistency, and lethality. There are different kinds of sterilization methods, such as flash sterilization, low temperature sterilization, ethylene oxide sterilization, and others. Though these work on different kinds of ways to kill bacteria, each sterilization technique makes sure that the medical instruments are safe and clean to use. Lastly, the use of proper donning and doffing of personal protective equipment or PPE can help in preventing the transmission of microorganisms from the healthcare worker to the patient and to themselves. Our clothes carry germs wherever we go. We do not want our everyday clothes to be contaminated with patient fluids or other foreign materials. So it is important we protect ourselves and our patients or other healthcare workers. Having all the materials first is the best way to make sure that we can be as clean as possible and reduce the transmission of bacteria to us. There's also a proper way to wear these materials as it is essential to follow them. Failure to follow them may lead to you being contaminated and, as a result, be a liability in the handling of sterile materials as you may be carrying germs. The materials needed includes a gown, clean gloves, alcohol-based hand rub, hair cap, N95 respirator mask, a face shield, and shoe cover. While other hospitals may require you to get more or less the same materials, this is the base level materials you may need. There is also a proper way in discarding or doffing our PPE. The same rule applies. Failure to properly execute the doffing of your PPE can result in your clothes being contaminated with germs or other foreign matter. The point of emphasizing the need of healthcare workers to be conscious about preventing infection is so that the clients can be safe from any transmission of pathogens from us to them and from them to us. Infection prevention and control practices are important in maintaining a safe environment for everyone by reducing the risk of the potential spread of disease. These practices are designed to reduce the risk of hospital-associated infections and to ensure a safe and healthy hospital environment for our patients, clients, other healthcare workers, and visitors. Some of the ways we can accomplish this goal is by having proper hand washing techniques, a sterile working field, sterile medical instruments, and donning and doffing of the PPE. By properly knowing and executing these materials and procedures will result in a safe, sterile environment in which it is free from pathogenic microorganisms.